Did you sprain your knee? We're going to go over today some of the different types of ligaments you could have injured if you sprained your knee. My name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist and co-founder of the Basketball Doctors. Our goal with the Basketball Doctors is to provide evidence-based information regarding all things basketball, rehab, performance, and injury prevention. This is all for educational purposes, not medical advice. If you need medical advice, send us an email at admin@thebasketballdoctors.com or reach out to your local physical therapist or physician. So let's jump into the topic today regarding knee ligament sprains. So here's your knee model. So whenever you injure your knee or you sprain a ligament, you kind of cause some partial tearing of a ligament. So whenever there's a sprain, that's partial tearing of the ligament, but very minor. There's different types of sprains. There's a grade 1, grade 2, grade 3. Depending on the grade is depending how severe that injury is and how long the recovery is. But most of the time with ligaments, because ligaments connect bone to bone, they're more for stability. So you might not have so much pain, but you might have more instability depending on the ligament that you've injured and depending on what movements you're doing. So let's go into it. So here is your right knee. Here's the outside, here's the inside. We'll start off with the outside. So the outside, there's the lateral collateral ligament. The lateral collateral ligament, otherwise known as the LCL, connects this part of the bone to this part of the bone. So your femur to your tibia, to this bone here, the fibula. But what happens is you usually injure this when your knee's slightly bent and someone pushes you from the inside and your knee goes out to the outside. As you can see, it stretches out that ligament there. Or if you just land and all your weight goes out to the outside. So whenever there's a force going to the outside, pushing from the inside, that's going to injure this ligament. If we go on the opposite side, we have the MCL, medial collateral ligament. There's 3 fibers to it, and this has a good blood supply, and it connects this bone to this bone, femur to tibia, but it also connects to the medial meniscus. This gets more commonly injured because normally what happens is sometimes someone might hit you from the outside, push this knee to the inside. As you can see, this stretches out here. When that happens, we have an injury there to that ligament, and that's what might cause you pain because there's more blood supply than the LCL. So that's the medial collateral ligament. So to kind of recap quickly, the collateral ligaments, lateral collateral ligament is when someone hits you from the inside to the outside. Medial is from the outside to the inside. The next one is we have the ACL. As you can see, the ACL is deep inside here, and the ACL connects this bone, the femur, to the tibia. And that happens normally, gets injured when there is a pivot or a shift in the knee. When there's a shift, it hyperextends because the ACL goes in a little angled, and that causes that tear there. That ACL is more for that stability of the whole knee joint. Here, the MCL is more stability going to the inside. Lateral collateral is more to the outside. ACL is for the whole knee joint. Now we go on the back side, we have the PCL, posterior cruciate ligament. We have the anterior cruciate ligament and posterior. Posterior is harder to tear because what needs to happen is your knee has to be slightly bent and someone pushes this bone to go back. That ligament provides that stability of the knee as well, but it's one of the least common ligaments to get. And here's another ligament that you probably didn't know about. It's the last one and one of the most common ones for people that dislocate their kneecap. So whenever you dislocate your kneecap goes out to the outside, to the lateral part. There's a ligament here called the medial patellofemoral ligament. That ligament provides stability to the kneecap to keep it to the inside. So if your kneecap goes out to the outside, lateral, you might injure that medial patellofemoral ligament. And when you injure that, your kneecap, the way you kind of tell is that you keep on dislocating your kneecap because now you don't have stability in the inside. So those are the 5 common ligaments that are torn. So we'll kind of recap them. We have the medial patellofemoral ligament, usually happens when your knee gets dislocated, kneecap gets dislocated. The medial collateral ligament, when someone hits you from the outside and pushes to the inside. The lateral collateral ligament, someone pushes you from the inside to the outside. The ACL, anterior cruciate ligament, usually some hyperextension rotation. Posterior cruciate ligament, the door dash hits you, boom, here, knee goes back that way. Those are the common injuries. So when you sprain those or injure it or tear it, one of the things that they do is they do certain tests for those ligaments. Also, they check the MRI to confirm, because those tests are good, but the MRI is kind of the gold standard to see if you tore it. But the most important thing is more symptom-based. Like I mentioned, guys, all these ligaments, if you've injured it, you're gonna feel some weird instability or giving out the direction of where you injured that ligament. So if it's in the outside, you might have some giving out going to the outside. Inside, the MCL, more instability going to the inside, versus the ACL is just instability of the overall knee, and medial patellofemoral is instability in the kneecap. So hopefully you guys learned a lot about these ligaments, the different types of ligaments. Everyone asks like, hey, I sprained my knee, what ligament did I injure? Hopefully you got a breakdown of it. If you like this video, hit the like, subscribe button, share this with friends and family. But yeah, stay tuned. We're gonna shoot even more videos, and let's ball for life, guys.